Yeah, violence is a contagious disease. It's a disease because it has characteristic signs and symptoms and a change in function of an organ or system that is primarily very characteristic. I mean, and causes morbidity and mortality. Actually, it's the #1 cause of death in many of our cities of young people. So it's frankly the cancer or heart disease of the young. Like one case of flu leads to another case, more cases of flu, or colds lead to colds, or TB leads to more cases of TB. A violent event usually leads to more cases of violence. So if you look at it either clinically or epidemiologically, it's being transmitted. And we even know more now about how it's transmitted. We know that people's brains pick up the behaviors of others and actually copy them. And we know that people are doing what's expected of them, and that's a way of following. So if you're in a community where violence is very common, you see it a lot, and your friends expect it of you. So even to small insults or someone giving you a disrespect or looked at your girlfriend, violence can come from these things if you think your friends expect it, and then more and more events happen. So when you are treating a contagious disease, you need to find people who have who have a disease and who might transmit it to others, and you have to try to prevent that transmission from occurring and then preventing further spread. And that's what you do if it's TB or cholera or so on. So the same principles applied to violence, that is to say looking for a first case and preventing it. If you don't succeed in preventing it, then preventing the next series of cases. And that's what the Cure Violence method does. It hires interrupters to do the first part of the work, and then behavior change or outreach workers to reach the other people who might have smaller cases of it. And by applying the interruption, the outreach, the behavior change, and the overall change of norms in a community, like you would do for changing norms having to do with smoking or sexual behavior for AIDS and things like that, we have seen reductions of between 40 and 70% in shootings and killings. And these kinds of numbers have been piloted, replicated, and externally and independently evaluated by the likes of the Justice Department, the Centers for Disease Control, Johns Hopkins. I mean, major studies have gone into demonstrating that treating violence like a contagious disease effectively reduces the violence in a neighborhood and makes that neighborhood safer. We in health begin to have a much, much larger role, in fact, possibly the central role in controlling this problem. And so what does that really mean? It means three things. One, it means that health departments begin to use epidemic control strategies like they use for TB control or for AIDS control to make the neighborhood safer. So this stuff gets managed. The epidemic control, the cure violence approach starts to get managed by health departments. Secondly, hospitals need to have interrupters coming when there's someone shot, both for the purposes of working with the person should he or she live to prevent the relapse when they're released, as well as preventing the retaliation. And that becomes then a hospital to community interaction. And so then you have a hospital working with the community for reducing the violence. That's their part of it. And the third part is all of the behavior change that we need to do, whether it's with young people, whether it's about child abuse, whether it's about family violence, whether it's about community violence, whether it's earlier stages or later stages. All that we know in the health sector, all of our practitioner knowledge about behavior change and changing norms needs to now get inserted throughout the healthcare system and healthcare people working in all the other systems that are currently seeing people who have violent issues.